Everybody should be able to see my screen and all my notes there. Everybody see everything?
Yep, it looks good.
Fantastic. Well, glad you guys could make it to this virtual workshop. Today, we're going to be focusing on clenching and how that causes headaches, jaw pain, and tinnitus, or ringing in the ears. My name is Dr. Carl Wharam. I'm a physical therapist with Physio Partners Renaissance CranioFacial Group. And if you have any questions as it goes along, just bring it or just type it over in the chat and I'll look at the end and we can go over those questions. Okay, so just a brief about me. I grew up in Michigan. I got my doctorate of physical therapy from the University of Michigan. I was there for a short time before moving out to Chicago, where I started working with a lot of stressed out lawyers and finance people. And from there, I started looking like, well, how can I help them get better? Which led me to learning about breathing, and which eventually led me to the Renaissance CranioFacial Group. I've written for the Grand Rapids Lawyer Association, the Chicago Bar Association, and the DAD website. I have a raptor dog. This is Cora. And I've been riding motorcycles since I was 5. This is me. This is my dad. And this over here, looks like it'll do it, is Steve. All right, and that's a trip we took down to Tennessee, but more importantly, all right, so the big problem that we're talking about is clenching, which there's a broader term called bruxism. That's kind of an umbrella term. Bruxism is essentially when you have any clenching or grinding, and that can be conscious or unconscious. So you can even do it while you're sleeping. Clenching is when you squeeze your teeth together, but you don't have any movement. Grinding is with clenching, but usually there's some back and forth or side to side motion that goes along with that. And some common problems that will come from it are jaw pain, especially like when you wake up and your jaw's really sore. You can have headaches that come from this. And then you can have tinnitus or ringing in the ears. And clenching is really correlated a lot with stress. And that's what can be from when your sympathetic nervous system kind of goes into overdrive. This is your fight or flight response. It's on for too long. Your trigeminal nerve, which is a nerve that innervates your face, can become overactive, and this can cause you to clench. Some people will have a narrowed airway, and they will actually tense their jaw to help them breathe better. And then some people even just clench their teeth because they have a response to the stress, and they're stressed out because kids are jumping on their last nerve. They're stressed out because coworker lost a shared file, and they're just trying to find a way to get all of it out of their system. Come on. Okay, so whoops, went too fast there. All right, so at Renaissance CranioFacial Group, we do a variety of tips, tricks, and tools to help with this. But 4 of the main ones that we focus on are balancing the bite, helping people have the correct posture, helping people breathe better, and improving their tongue posture, which is really just where your tongue is at and making sure that it's in the right spot. So, all right, so before we go on, I just want to go through a brief little bit of anatomy. So we have our temporal mandibular joint. This is right here. This is where your temporal bones will meet with your mandible. And that's where the temporal mandibular joint gets its name, or the TMJ. This is what people think about when they think of the jaw. We also have our masseter, which is a muscle in the cheek. We have our sternocleidomastoid, or SCM, that runs from just below your ear up to your clavicle. We have our atlas, which is also the first vertebrae. And then the upper trapezius, which this is the muscle that people talk about if they're going to get their shoulders rubbed out. This is usually that muscle. It runs from your ear all the way down to the outside of your shoulder. All right. So now clenching has a lot of roots with stress. It's very much one of those things like when people get stressed out, they start to clench. And I don't know if any of you guys have been stressed since about March of 2020, but it's a little stressful right now. And stress does, a variety of things to people. Some people will stress buy, some people will stress eat, some people will stress clench. And so when you have all this stress, it's definitely correlated with clenching more. Stress will also cause trigger points, which is a fancy term for knots. So if you ever talked about knots in your shoulder and you just want to get them rubbed out, those are the trigger points. And those muscles we went over earlier, the masseter, the upper trapezius, and the SCM, when those muscles get really tight and dysfunctional, then they will actually start referring pain into your head. You'll start getting some headaches. You can get some pain in your jaw. Some people even talk about how they have ringing in their ears. And this can be all from some of that stress. So, all right. So one of the things that we can do is help people have a balanced bite. And this means that your teeth are hitting evenly. So we have our right side of the teeth and then the left side. This right side is higher. So that means we have more compression on the right side than the left side. Now, if you were to actually stick your fingers into your ear and open and close your jaw, you can actually feel your jaw moving. So it's very close to each other. So if one side hits more than the other, you can get more pressure up to that side of the head. You can get some ear pain, those cranial bones take more load, and it ends up causing more wear and tear on that side. Now, also, the unbalanced bite will respond to how the head is. So you can simulate having a balanced or unbalanced bite. If you tip your right ear to your right shoulder and click your teeth together, versus if you do left ear to left shoulder, click your teeth together, it'll feel different. Now, if you look up towards the ceiling and click your teeth, or if you look down towards the floor and click your teeth, you'll see how your head position can change how your bite is. And so if we have a balanced bite, we can take a lot of that pressure off. Now, one of the techniques we do is called the Atlas derotation technique. And this can help make sure everything is balanced so that you're hitting. And since I can't show this to you in person, I have a lovely video for everybody. Right. So if the bite isn't level, then some people, if they get a night splint or a bite guard, will actually have pain with that they didn't have before. And so if this happens, then we can work with the dentist to make sure that everything is level before getting it readjusted. And we will see if YouTube wants to. There we go.
We don't hear it.
Yeah, I can't hear.
Is it not playing?
It's playing, but it does. You can't hear the volume. So I think you might have to say what's happening here.
Okay, so I'll narrate it then. Okay. So what I'm going to do here is check her upper cervical mobility and how well it moves. So right now I'm checking how far she can move her head to the right and now to the left. So I'm using the fingers to kind of mark it. And since her left side can move more than the other side, we know that the vertebrae isn't moving as well. Most of your rotation actually comes from the upper part of your neck. So it's those first two vertebrae where most of it comes from. So with that, we think there's a dysfunction there. And now I'm going to check how her bite lines up. And you can tell this by how it pulls out. So here she's going to bite. And my right side came out first. So that means there's more pressure on the left. My right finger, her left side came up first. So there's more pressure on the other side. So this is where I'm going to do some mobility work on the upper part of the neck. I'm going to do an upper cervical distraction and decompression to kind of help open the joint before I work into it. And then here I'm going to rotate and bend her head and then use some muscle energy technique. It's a gentle way to help de-rotate. So she's looking to alternate between the right and the left to help pull that atlas so that it lines up a little nicer. And so I'll do this about 3 times. She's just alternating, looking between right and left, turning her head and looking with her eyes. So now that we've worked on that, I'm going to recheck her bite. And now since the fingers came out together, then it's kind of rotate it back so that it has a level bite. Okay. All right, so we've all heard that posture is really important, and especially in our quarantined world, we're spending a lot more time at our computers and a lot more time on couches. And this tends to pull us forward so that we kind of start looking like a banana. So to illustrate it, this person here on the left, their head is in front of their shoulders. So the ear is in front of that shoulders, and they essentially have an extra bowling ball worth of weight on their neck. So this person here with their head more forward, it's like you're adding a second bowling ball. So this person is walking around with 2 bowling balls kind of on their head. This third person over here, this is essentially like having 3 bowling balls. All that pressure is going through the muscles, and because the muscles are having to work, it can't just let the spine support it. Now, having the head forward will also cause your jaw to go backwards into the jaw, and it'll put more compression onto that joint. Now, especially with this, the disc that's between your temporal bones and the jaw tends to go forward when your jaw goes back. So this makes it more likely that it's going to pop out of place, more likely that it's not going to move as well. And so getting upright will alleviate a lot of that pressure, because when we heads forward like that, we get much more wear and tear on the joints. You're going to need more dental work. It's going to be harder to breathe because you're not going to have as much airway support. And it also makes you look shorter. And I'm short enough as is. Any extra height that I can get is a plus. So ideally, we want this ear to come right over the shoulder, and so that we can have these nice normal curves within our body. Now, easiest way is to have yourself standing up against the wall, so that the back of your head, your upper shoulders, and your butt are touching the wall, which is great, but some people get really focused on their work and they get really involved, and next thing that they know, it's been 3 hours and they haven't gotten up. So a way to work kind of around that is what I call the slouch overcorrect, and I'm going to show you. So we're going to stop this. So what this is, most people are kind of sitting here. You're going to sit up tall. You're going to kind of pull your chin backwards, tuck your shoulder blades into your back pocket, hold for 5 seconds, and then relax. And so you'll be sitting up, pulling your head back, tucking those shoulder blades into your back pocket, and then relax. And then one more time, sitting up tall, pulling the chin back, shoulder blades back pocket. And then this time, you back off about 10%. And that ends up getting you out of that bad posture. It gets you into a spot where you're more likely to be sitting upright and you just feel better after getting stretched out a little bit. So, all right, so that is an easy way that you can fix posture on your own. All right, so one of the other things we do a lot is breathing retraining. And this is a big thing because it can help you relax. One of the methods we use is the Buteyko method, which teaches you to breathe through your nose and into your diaphragm. This will push you towards a rest and digest phase. It'll help shut off that fight or flight and help calm the system down so that you're less likely to clench. As I've done this, I've had people who, they say the ringing in their ears gets less, they're more alert, they're feeling calmer, people fall asleep quicker. And anytime you can get better sleep, I just about never have enough energy. So anytime you can get a little more sleep is a fantastic thing. One of the easiest ways I found to help people with this is if you breathe in for 4 seconds and then out for 6 seconds through your nose. The nose is for breathing, the mouth is for eating. Just breathing in for 4 seconds and out for 6 seconds. Even if you do start out about 3 minutes a day, you can help calm yourself down, make it so that you can relax. If you can work up to 15 minutes, great. If 3 minutes works for you, then even that's a good way to help keep your mind from racing so it's not going all over the place. So, and then the other big thing that we work on is tongue posture. And essentially this is just, where is your tongue? Most people fall into one of 3 categories. It's either at the bottom of their mouth, their tongue is either hanging out in the middle, or it's sitting up near the roof of their mouth. And ideally, we want our tongue sitting up behind the front teeth and near the back molars. So the easiest way for this is if you try and say the letter N. So if you do N, you should feel your teeth, your tongue kind of right in this area. If you say the word sing and really emphasize the ing, if you do sing, you'll feel it in the back here or near those back molars. And there, that gives us good tongue posture. So this is important because it'll promote facial symmetry. It'll make it harder for you to clench. So if you tried clenching with your tongue at the bottom of your mouth versus if your tongue is at the top, you will actually find it harder to clench with your tongue up at the roof. Yeah, so it's a fun one. And we have, so I'm going to show you, for the more visual people, we have a model. So we want the tip of the tongue to be right kind of in this area. There's actually a little landing pad. You can feel some ridges on there. So we want the tip to be here. And we want the back part of the tongue to be touching on the sides. So those 3 points of contact are what help you get into that good posture. All right, so we'll go back here. Okay, so many times when I tell people that I do physical therapy for the jaw, they look at me like I'm a crazy person and that, how would you ever do this? But get rid of those for a second. What we do is a lot of intraoral work. So we'll actually go inside the mouth and work on giving it some massage, help distract some of the joints so that you can get some synovial fluid in there, which will help heal and decompress everything. And then we also work a fair amount on the neck. And just like if you have tight hips, you're more likely to have knee or back pain. If your neck is stiff or it doesn't move well, then you're more likely to have jaw pain. So anything that's around the joint can impact it. So we work a lot inside the mouth, we work a lot on the neck. And just to kind of showcase that, Dr. Hobson has a video where she is doing a joint distraction. So she's going to be opening up Miranda's jaw to help give it some space and decompression in there. And I'm just going to assume you can hear it again. So what she's going to do is put her thumb on the back molars. And she's just going to have Miranda open with her. So it's a teamwork at this point to help give it a nice little stretch. And she's finding the most relaxed position right now. Here's where she's doing a little bit of a distraction and then backing off. Do it about 6 times. We're just holding for a second, looking for a distraction down near the joint. Okay. She'll do this about 6 times, holding on the last one to really let it open up and rest. Okay. Stop it. All right. So, what are any questions that you guys have for me? Me and all questions will get out of. Yeah. Okay. All right, so someone said, what length of time is the treatment and how many sessions does it take? So treatment time, we usually book for 45 minutes to an hour per session. And treatment to get better, that will kind of vary depending on how severe it is. If something is like really acute, then it'll take a little less time. If you've been dealing with jaw pain for 10 years, it's going to be a little slower. So it will vary depending on what's going on, but within a month you should start to see things improving. Okay, and let's see, what does it mean if my jaw pops? So popping is usually when the disc, so earlier we talked about if your disc is going forward as your jaw is going back, usually it means that the disc is not sitting up on the condyle properly. And when you hear that pop, that's when that disc is going back onto the condyle where it's supposed to be. Okay, what sort of homework do people normally do? So one thing we like to do a lot with people to help lubricate and ease up pain in the joint is if you put your tongue behind the tip or your teeth at kind of that tip where if you said N, so keeping it there, and then opening and closing. So it looks like that's one that we do a lot to help lubricate. We do a lot to help with posture. So another one we like to do is chin tucks. So where you're kind of pulling your head back to stretch the neck and to open up the suboccipital space. Oh, okay. So those are 2 very common ones we do. Okay, my jaw pops, but it doesn't hurt. Should I still get treated? So the jaw popping, it might not be painful now, but with it not being there, you are going to have those extra compression force in there because that disc is designed to help absorb and help everything move better. And so as that, should you get treated? I would say yes, if nothing else, because you don't want a surprise dental bill or to wake up with pain. So I would definitely look at it. How often would you do the posture correction technique? If you can do it like any times, that's good just to get out of that posture. Ideally, in the perfect world, I would say like, every 2 to 3 hours just to break up that posture. But any times you can do it is better than no times that you can do it. Okay, did I miss any questions? All right, does treatment hurt? So usually, no, treatment usually doesn't work because we're doing a lot to work with the body and a lot of soft tissue stuff. The only thing that some people think might hurt is we do a technique called dry needling, where we take a thin filament needle, same as they would use for acupuncture, and stimulate the muscle to contract and relax. But usually more people talk about like a soreness or an ache. A lot of times it feels like if you worked out really hard and you're not used to working out, and then you're like, oh wow, I'm really sore. That's more what it feels like. Are there things to do at home for the Atlas D rotation? Yes, there are. So once we work on getting it so it's lined up and making sure that it does it consistently, so then we can teach you how to do it on yourself so that you can do it if something's feeling off, and we'll also give you stabilization exercises so that it doesn't keep coming back. Does insurance cover this like regular physical therapy? Typically, yes. It will depend a little bit on the insurance that you have, but typically it is covered. We do offer benefit verification so that you have a general idea, but I would always say, like, if you have questions, like, talk to insurance, but yes, typically it is covered. What is the name of the breathing technique? So it's called the Buteyko method. So let me see if I can spell it and then I can check. So I believe Buteyko is spelled like this. Don't quote me. I am a terrible speller at times. But Buteyko breathing, if you Google the Oxygen Advantage, that's a book that one of the guys wrote for it. Why does clenching sometimes lead to tinnitus? So with the clenching, you have a lot of force going right by your ear. So your jaw and then your ear are right next to each other. So with that being so close, all that extra compression can lead to dysfunction around the ear. Clenching will also tend to mean that your SCM, so that's muscle running from here to here. And when this muscle gets really tight, this will make people have ringing in the ear. So between the compression forces and muscle dysfunction, that's a big one that leads to it. Do you have any recommendations for sleep position to help the jaw, or does it not matter? So I would say as long as you're not sleeping on your stomach, that's going to be good as a general rule, because you're spending 5, 6, 8 hours off to one position. So you're getting loaded all that time. And even if you just push on this, you can feel your other side getting hurt. Now, with that, usually I would recommend sleeping on your sides if you're a person that snores. If you're snoring, then sleeping on your back is going to make it a lot more likely that you're going to snore. You're going to get worse sleep. So in general, I would look at sleeping on your side if you snore. And if nothing else, don't sleep on your stomach. That's going to be a worse one. Okay, and then I had talked about the Buteyko method earlier. We do have a breathing clinic that we offer online, and once COVID hit, or once COVID is done, we're going to be doing that in person. That is something Dr. Hobson works on, and so we have a Zoom, and we're currently having a special with that. So I can get you guys more information if that is something you are interested in. Or if you want, you can go to hobsoninstitute.com. I can type that over. Put that. Okay, let's put that link there. Okay, night splints. Night splints can be very helpful for people who do have that clenching. It can be something that is really helpful, especially if the person does have a history of grinding and clenching at night. So they are something that can be really helpful. They are something we do work with a lot of dentists to make and to make sure that they're optimized. So they can be appropriate, but that is something that you'd probably be better off asking your dentist because they're going to be much better at making that and working with you. We work with the dentist to optimize that, but overall we have seen people who do well with them. All right. Any other questions? Okay. All right. Well, glad you guys enjoyed it. Glad you guys can hang out over lunchtime with me. Hope it was a nice little break for your day. All right. And then let me I do have my email, so you guys can email me with questions if you would like, and I'll pull that up. Okay, my email should be on here. So this is the contact information. And you guys, I don't need to see that. So, but thank you all for coming.
Thank you.
You're welcome.
This was helpful.
Good. Good.
Very,
Thank you, Carl.
very nice, Carl. Good job. Thank you so
It
much.
was a great session. Thank you, Carl.
You're welcome. Okay, so